Thank you for joining our session on accelerating the transition to telehealth with AWS. My name is Danielle Miller, and I'm a healthcare executive advisor for nonprofit healthcare with Amazon Web Services. I'm a registered nurse by background, and I've spent the past 17 years focused on healthcare delivery. The innovation in technology is what actually led me to AWS. So I'm excited to introduce our guests at MedStar Health, who will share their experiences on having to accelerate the transition to telehealth. Kurush Samia started as a systems engineer and has been the senior database administrator at MedStar Sitel for almost 12 years. Kuresh is a member of MedStar Institute for Innovation, known as MI2, whose mission is to catalyze innovation that advances health. This includes Kuresh's team within the MedStar Simulation Training and Education Lab, previously focused on online and live simulation training, learning experiences in specific focus areas. And prior to March, that included a small telehealth innovation group. This is the agenda we'll be discussing today. I will touch on how the COVID-19 pandemic accelerated the need for rapid scale of telehealth options and healthcare organizations. I will share the functionality and how it played a key role in the ability to scale services. I'll then turn it over to Kuresh, and he'll take you through the journey of MedStar Health, where he will discuss what the organization needed. He'll talk about the architecture and the design of the solution, the impact the solution had to the business as well as patients, and then lastly, he'll speak about the experience they had with working with the team at AWS. The COVID-19 pandemic has led to changes in the way that healthcare is delivered. Although telehealth technology is not new, the widespread adoption of healthcare providers is new, and patients had to accelerate this year in the wake of the global pandemic. The market has had to pivot quickly in order to meet the needs of virtual health options due to COVID-19 and support the rapid need to scale and accelerate adoption to telehealth. AWS has partnered with other independent software vendors to support and help organizations run a telehealth business for wellness and health at scale. Companies like Cerner that enabled care at a distance through telehealth solutions. Companies like Care Monitor, who built their telehealth audio and video calling capability in their Care Monitor application using Amazon Chime SDK. And all of that work was done in under a week. Or companies like Ease, a HIPAA-compliant video conferencing solution that could integrate existing iOS and Android messaging applications that are used at hospitals across the country. Amazon Chime SDK allowed their engineers to add two-way call video communication into our mobile apps, all again within a week. In the partnership with MedStar, we leveraged Amazon Connect to establish and support an operations call center within the telehealth team. I want to give a little background about MedStar Health. So MedStar Health is the largest healthcare provider in Maryland and the Washington, D.C. region. MedStar Health's 10 hospitals and network of urgent cares, physician offices, and regional ambulatory care centers are recognized regionally and nationally for excellence in medical care. And with the expanding needs for telehealth and the COVID-19 pandemic, Kurush redirected all of his staff and resources of MI2 to rapidly build, scale, and support telehealth solutions. And with that, I can turn it over to Kurush, and he will discuss their experiences with establishing and supporting an operations call center with the telehealth team and their experience working with AWS.
Thank you, Daniel, for the introduction. Here at MedStar Health, like most healthcare systems across the country, we were forced to completely rethink how we provide care due to the rapidly evolving impacts of COVID-19. In order to prevent the spread of coronavirus, virtual care became a necessity almost overnight. I mean, to give you a sense of scale, for instance, in February of 2020, we provided about 240 video-based telehealth visits, and that was like a typical month. Suddenly, telehealth became the only way to receive most care as the country adapted to the new norms. Now, between mid-March and the last week in September, we provided over 440,000 telehealth interactions. Just imagine. The MedStar Telehealth Innovation Center had been advancing telehealth at MedStar for a few years and already had existing vendors for providing video visits. When demand surged, we were able to work with those vendors to scale our use of their platforms. Video technology was not the problem, but the real challenge was figuring out how to build new workflows to support telehealth at scale. MedStar excelled because we were able to focus on a wraparound services to get our patients and healthcare providers ready for virtual care. The most common type of video visit was a scheduled visit, which replaced an in-person visit you schedule ahead of time with a primary care provider or a specialist. This was about 80% of our visits. We also have MedStar eVisits, which offers 24/7 on-demand care that you might get at an urgent care facility. We also developed new ways of using telehealth, including having some patients who come to an emergency department seeking care for to be screened by a remote provider who may be able to treat and discharge them without needing the patient to go into ED. We also used telehealth in inpatient care. Some nursing communications with patients was done virtually with tablets, which help converse PPE. We used similar methods to connect patients with family members who were unable to visit in person. These are just some examples of many new uses of telehealth across our organization. With these drastic changes in care came new workflows and technology, and much of it was developed live in the field. This left gaps between our telehealth services, and we had to close those gaps fast to provide seamless care. Some patients and providers had technical difficulties using the technologies. Others needed to be walked through new processes, and we needed to support the staff and patients with their day-to-day questions. The situation was so dynamic that the only way we could support all these changes was by establishing an operation and basically support call center within the MedStar telehealth team. This center handled support calls from providers from all of these different telehealth workflows, providing guidance and real-time training and troubleshooting. So at first, we tried to use a traditional way of making and expanding call center using PBX system, which we had done before on a small scale. As you can see in the pictures, we turned one of our conference rooms to a call center, and everyone jumped in to answer calls and help out. As you can see, this was before current masking and physical distancing guidelines were in place. Soon we realized that this model would not work for the load, scale, and agility we needed. Due to social distancing, our workforce had to work from home almost immediately, and we had to go back to the drawing board. We thought the best approach was to go with a third-party company because we did not have experience with this kind of solution. However, we talked to a couple of companies that were providing call center services, and right away we noticed that this was not a good model due to the lengthy process of building and maintaining the call center. And this is basically where Amazon Connect story started. As soon as we realized that the third-party company services were not suitable for us, we considered building a solution ourselves. And Amazon Connect immediately came to mind. Back in the 2019 AWS reInvent conference, we attended one of the Amazon Connect sessions, and we were exposed to the concept, but had no idea the power of it, nor how to start building with it. After all, it was the only solution we had at the time, and it seems like it was a good fit for this problem, though. After a brief discussion with our team, we decided to basically build our own solution with Amazon Connect. Without any prior knowledge or skill with the tool, we build a call center in a matter of hours. As you know, one of the IT challenges with large organizations is that it is difficult to move quickly, but we had to act and act fast. So Connect was a big win for us since it gave us the flexibility to scale rapidly and provide our agents with the capability to work from home and support our telehealth operations. MedStar Health faced another challenge in the early days of pandemics. Many people were seeking lab results, particularly for the coronavirus test. And in the first few months, these tests were taking 2 to 7 days to get the results. These results then had to be communicated back to patients. We had to figure out how to get the thousands of these test results to patients and basically consult them on what to do next. The success story of building and deploying our call center spread around MedStar. They saw the speed at which we build up our call center and asked if we could do the same for the lab result callbacks. We quickly learned that this time the problem was more complex. For example, some of their agents needed to work remotely and other agents were in an office settings. At the same time, these agents are supposed to work for different departments as well. And I will go over some of the other complexities in the next slide. But it was in this project that we realized how the flexibility of Connect allowed us to build solutions to support our workflows rather than constraining our operations due to a technologist's rigidity. So I will go over the lab callback center, which was a complex flow to design. In brief, we got the requirements on Wednesday, and we were told Monday 9 a.m. Agents should have been trained and ready to take the calls. Like basically, we had to go live. Every time we contacted the stakeholders to clarify some issues or items, some of the requirements were changing, and more complexities were added to the call center. This is because we were all trying to build the plane as we were flying it. So they did not know the full scope of how their operations needed to run, and they were trying to understand the magnitude and the flow of the new call center. So here's a summary of the final requirement we were finally agreed upon. They needed a call center with 5 different departments: urgent care, occupational health, hospitals, outpatient medical practices, and emergency department, which each of them should have their own operational hours, each department with 2 types of agents, physicians and regular agents, who can transfer the calls to each other and other agents in other departments. Having the capabilities of the secure, unique voicemail system for each department, which only specific users should have access to it. At the time of agents logging, system should identify automatically which department they will be working at, with inbound and outbound calls, and a whitelisted toll-free number. So basically, we did this in 2 days, tested and trained agents in a day and a half, and we were live on Monday at 9 a.m. Our approach was to divide the requirements into small parts, build small, and test each piece before we move into the next section. But before we did that, we had to learn our way, basically how to do it. So we started by looking at some default flows found in an Amazon Connect instance after creating it. Watched YouTube, read the AWS documents and the videos they have on the website. Using provided examples, we started building the first flow and tested that. Continuing this process, we were able to build, test, and deploy the call center in 2 days without any prior knowledge. Basically, we moved from left to right in 2 days. One of the main challenges we had then was how to build unique voicemail systems for each department. We started by creating basically a hack, not knowing Amazon just released an out-of-the-box voicemail stack. Our first solution was to create a voicemail agent and configure it automatically, answer the call, and save the conversation in an S3 bucket. and email it as an attachment. At first, it sounded like we solved the issue, but soon we realized it was not working all the time, and we had to keep the browser and computer up and running all the time. As soon as the computer would go to sleep or wanted to do upgrades, the voicemail agents was not available. With the help of AWS support engineers, we were able to set up the voicemail stack and deployed almost immediately. We created separate shared mailboxes in the MedStar email server for each group. So the agent would have access to them and could listen and answer the voicemails right away. As a useful feature in the Amazon Connect voicemail stack, was the capability to transcribe the voice, encrypt it, and send it, send them all as a package into an email. One issue we noticed was the short availability time for the voicemail link on the S3 bucket. We needed it to increase the time beyond 6 hours, and AWS support engineers help us modify this feature and get it up and running pretty fast. So we started generating automated reports using Amazon Connect historical report feature and send them to the managers to see their daily activities and monitor their performance. This feature is helpful if you want to monitor and improve your workflow and the process. We solved the unique login request by providing one link to the soft phone portal and a common username. However, if agents wanted to log into a specific department, for example, ED, they would add ED to the end of the username. In the user management, we would route the ED calls to that specific agent in case of availability. Basically, assigning multiple usernames to a single agent and making it easy to remember. So what we've learned throughout this process, we learned, make sure if you wanted to claim a number, pay attention to the type of the number you choose. A toll-free number versus a DID or direct inward dialing. The pricing is different. Also, train your agents to mark themselves unavailable and then log out instead of closing the soft phone portal page. This will show them as an available agent and will hurt their stats and your report at the end. Always pay attention to your service quotas in AWS. You might need to increase some of the quotas to improve your performance and troubleshoot issues you might come across. Remember, it's all about your usage. Sometimes you might need to troubleshoot the problem on the client side. To do that, train your clients on how to download the CCP log. Always start small, break the requirements into small pieces, and develop them one by one and test each basically step. Every step, get the clients involved, ask them to test the features, and do it right away if changes are needed. Amazon Check Connectivity tool is a great way to diagnose issues on the client side. Train your agents on how to use it. Have a naming convention. Name your flow properly. You can't delete them, and they will be there forever. We came up with our own naming convention and learned to start the name of the flow in production, for example, with active, flow in development with dev, and the retired flows with old and a version number. This way, we can easily find the older version if we need to revert back or work on a development flow without touching the production flow by mistake. And then I wanted to add that this was a collaborative and a team effort. And I have to mention some teammates here like Itai Mav and Dave Bauer and many others who really helped to make this effort successful. So our experience working with AWS, as far as the support goes, AWS has great business support. And we learned about it late, but we used it to the fullest. Amazon support engineers will provide you with tailored solutions to your needs and even go over and beyond the expectations to diagnose the issues, provide you with the fixes you need basically to do. For example, when we needed to build the voicemail stack, our process was broken, and not only we needed it to be fixed, but also we needed to basically some of the features to be changed to keep the voicemail active longer than maximum allowable time instead of 15 minutes, default basically. So the support engineer I work with took his time to review the stack, replicate it on his end, find a solution, and fix the issue. Basically, in Amazon Connect, you have a GitHub project which you can go and post your problems or questions that you have and find answers as well. But this was basically done fast. On the development and deployment, basically, this would have taken much longer in any other system we looked at, and not to mention not as easy and straightforward as AWS. Indeed, it cut our development and deployment time to the fraction of what we anticipated from other systems. Everything was documented properly, and we were able to follow the instructions and achieve the goals. Using Amazon Connect, updating and maintaining the call center is easy, and deploying the new features is seamless and hassle-free. We could deploy new features, basically, or patches on the fly as the system was live, and agents were answering calls with almost no interruptions. So Amazon Connect gave our telehealth team the capability needed to support fast growth in a dynamic and agile environment. Since March 2020, we have handled over 115,000 calls and combined over 200,000 minutes among 3 call centers we developed. The third system, which I have not talked about, it was a more recent request for a call center to support contact tracing for our occupational health department. We were also able to get that done in a matter of hours. And right now, we can build a simple call center faster than being able to train the agents on how to use it. So indeed, the call centers we created were one of the critical factors of telehealth success at MedStar Health. It allowed us to deliver over 37,000 e-visits, which is our on-demand urgent care solution, and over 350,000 scheduled video visits. Not to mention supporting all of the other ways MedStar has used telehealth to enhance patient care during COVID-19. Remember, prior to this year, we were only providing about 200 telehealth visits per month. At the end of the day, everything we do is to provide the best care we can for our patients and save people's lives. Here are some quotes from our patients about our support center and our telehealth solutions in general. And with that, I turn it back to Danielle to finish our session. Thank you.
We at AWS want to thank the entire team at MedStar and MI2 for collaborating with AWS and sharing their story. Karish, we want to personally thank you for sharing the MedStar journey with AWS and walking us all through the process from beginning to end. And thank you to all the attendees for joining our session. The COVID-19 pandemic has catapulted the need to have technology to facilitate virtual visits and support telehealth. Rapid innovation and customer acceleration allow MedStar to quickly pivot with their platform and scale rapidly. As telehealth continues to grow at an accelerated pace across the globe, more healthcare organizations will leverage this technology. Telehealth has a huge potential to reduce the cost of healthcare, improve patient outreach, and access to care. It also changed the way that healthcare is delivered and by providers. As time progresses, the technology will become more advanced and innovative. This will further impact the development of new devices and programs to help provide even better patient care that ultimately results in better patient outcomes. As AWS continues to work with healthcare organizations like MedStar, we are aligned to help you run a telehealth business that is flexible and scalable on an end-to-end platform of wellness and health across the entire care continuum. As you can see, we have several other healthcare sessions that are being offered, topics from healthcare executive outlook to fireworks on AWS, to using AI to automate clinical workflows, just to name a few. Please take some time to review all of our sessions and join those that are of interest to you. For more information on anything we spoke about, or if you have any questions about any AWS service or solution, please visit aws.amazon.com/health for more details. We look forward to the continued collaboration as we continue to innovate on behalf of improving patient care and patient outcomes. And with that, we thank you for joining our session on accelerating the transition to telehealth with AWS. Last but not least, your feedback is helpful to help us improve, so please take a moment to complete the session. And again, we thank you for attending our session.